I have asked Health Officer Jason Tiller to come on the line today and see if he has any information that he can share with us. I know that the news is all abuzz with the news of a coronavirus vaccine, and so I'm hoping that Jason has some information he can share with us about the situation locally.
Okay, let me stop you for a second. I was under the impression this was going to come under a different heading, so I have an introduction into this, if I might. And I too instructed Phil to invite Jason to the meeting today, rather than wait for another week. But in light of happenings since our last commission meeting, we've extended this invitation to Jason to speak. I want to first say that I've received some information from the Kansas Hospital Association specific to North Central Kansas. And that is, and the numbers that I'm going to give you briefly are specific to the population, the percentages in neighboring counties. Saline County right now, as of December 14th, 6.2% of our population has been affected by coronavirus. That is equal to Clay County, which is 6.2%, Dickinson County, which is slightly less than Saline County at 5%, and Ottawa County, which is right at 6%. It's amazing to me the counties who were slow to go with a mask mandate, and I will specifically say Cloud and Republic counties. Republic is at 9.6%, and Cloud is 8.5%. The big one was the county of Ellsworth, which was the last one to, I think I'm correct by saying they were the last one to approve a mask mandate, and their percentage of population that's been affected is 14.5%. So those are numbers that surround us. You can go a little bit further out in this report. There's 12 counties involved, and if you go a little bit further to the northwest, Osborne County has the least amount of effect from this at 3.5%, Mitchell County at 5%, Jewell at 4%, and Smith at 5%. So those are kind of a rundown of what's going on there. Since last week, we've had 448 additional coronavirus positive tests. This is since our meeting last week. And that's why I wanted to specifically ask Jason a few questions in light of the fact that it's been announced that the vaccine is available. Jason, I would like to know if you know anything about this, like how many doses is Saline County going to get? When is it going to happen? Where is it going to happen? Who's in charge? Those kinds of relative questions. If you've got the answers, I don't know. I haven't talked to you. So the floor is yours.
Yeah, so things have been happening pretty quick since last week when the Pfizer vaccine was approved. Unfortunately, right now, the information I have is mostly specific to the state. We haven't been giving anything specific yet to Saline County. And I just had a few notes I just wanted to kind of cover real quick first, and then we'll see what else we need to cover on that. So since the Pfizer vaccine has been approved, the feds and the state had already designated priority groups for those vaccines, and that was to healthcare workers working in or working dealing with COVID patients and long-term care facilities. And as of yesterday, we had not, nor had Saline Regional, as of yesterday morning, been contacted about receipt of vaccine yet. I'm sure you've already seen posts at this point that the first person, I believe, down in Sedgwick County got it, but we haven't gotten any details locally. The other vaccine, the Moderna one, is supposed to be up for review and potential approval later on this week. As for what we know right now, which I think is for probably the general public that everybody wants to know, is how many doses, when is that going to happen, when are we going to have it in Saline County? And unfortunately, we don't have those answers yet because a lot of this stuff is still in flux. The one thing I do know as far as for the general public that we've been told is that vaccine for the general public will not likely be available until late spring or early summer. Now, of course, that's always subject to change as more information gets pushed out and as more vaccine doses are manufactured and procured, but that's what we are currently being told. So for specific Saline County information, right now, as soon as we get information that is specific to Saline County, specific to residents, then we will start, as soon as we have it, pushing that information out to the public so that they know what, when, and where, and what's required. Right now, a lot of the conversation that we're getting is still kind of very much in general terms. There's still a lot of information, I think, that that we are being told that when it's our turn to get vaccine, and I don't know exactly when that is, even if it's for those targeted populations, that a lot of the other additional information as far as screening for the vaccine, paperwork, supplies to administer vaccine, all that kind of stuff will be coming with that. So anytime, in the next week or so, I expect to start hearing about those initial pushes for our healthcare workers and long-term care, but it's going to be a while for the general public. The other thing that I wanted to share too, as far as that, KDHE is putting a general vaccine update on their website once a week. We will be sharing those just to make sure that people are aware of them. And then the other thing that we were also told is to watch the governor's press conferences, because that's where a lot of the information regarding the vaccine will be coming out at her press conferences. This information is changing quickly as things happen, as things get, I think, finalized at the state level. And then we will have to probably have very short notice when we get information about vaccine coming to the area to be able to react. So we're just still going to be looking for that information, listening, of course, to all of our updates to find out what's happening and when. But as of right now, that's about the extent of the information I have.
All right, commissioners, anybody have any additional questions or comments?
I do. My first one is a comment, and I'm interested that things are in flux at the state level. People have known this was going to happen for quite some time, and I'm interested, first of all, that happens. My next is a question, is who's going to set the priority of who gets the shots in Saline County?
So for the initial doses, anything coming, I expect this month or probably next month, those priorities are being set by ACIP, which is the Advisory Committee on Immunization Practices at the federal level for some of it. And then the state will be setting those priorities for some other priority categories. And what they're doing, from my understanding, is that they will be sending approximate numbers of doses to be able to provide vaccine to those pre-established categories.
And I understand that, but let's just say, we have 10,000 or 1,000 healthcare workers that need to be vaccinated, and 800 doses come in. Who sets the priority of which healthcare person gets the dose?
That would be something then that we would have to look at internally amongst ourselves, the hospital, and figure out those that have the greater chance for exposure, and then prioritize them to receive the vaccine, and then move on from there. We expect that there'll be some that don't want to get the vaccine now, and that will want to wait on it. And that there's going to be some that's going to wait and watch and see what happens with, larger populations getting the vaccine. And as far as the state's concerned, I think there was a lot of generalities that they knew, but until things were approved and there was information pushed down to them from the feds as far as a lot of the details, I think that's kind of where the hang up for them has been.
And I will just say that Jason has been meeting with folks from both Salina Regional Hospital and Salina Family Healthcare to talk specifically about that prioritization. They met yesterday, I know.
All right, any other questions or comments? If not, thank you, Jason. Thank you to your staff. Thank you to everyone at the health department for, in the face of a tough time right here. So thanks for hanging in there.
Thank you for the time this morning.
Yep.